Welcome to Healthcare Bites for You. Did you know 4 out of 5 seniors are unknowingly sabotaging their own sleep each night? What if your 3 a.m. wake-ups aren't a curse, but a signal you can actually work with? In today's video, we'll explore why waking in the middle of the night happens so often as we get older, and more importantly, how you can reclaim restful sleep with simple, science-backed techniques. Why seniors wake at 3 a.m. Fact: as we age, deep sleep drops by about 20 to 50%, and time spent in lighter sleep stages increases, making us more likely to wake up around 1 to 3 a.m. Science: core body temperature naturally dips around 10:30 p.m., helping us fall asleep, then starts rising again between 1 to 3 a.m., leading to lighter sleep or brief awakenings. For seniors, this shift often leads to full awakenings rather than just light dozing due to reduced deep sleep. Framing: it's not your fault, it's biology. Recognizing it as natural removes the blame and anxiety that keeps you awake. The heart rate gateway: your heart rate needs to hit around 60 BPM, or drop at least 10 to 15 BPM to re-enter deep sleep. Waking at 3 a.m., your heart might be racing and stress hormones may spike. That's where parasympathetic rest and digest tools come in. Lower your heart rate, ease tension, and you'll drift back to sleep. Technique number 1, 4-7-8 breathing. The 4-7-8 breathing technique. Inhale for 4 seconds, hold for 7, exhale slowly for 8. Do this 4 times. It activates your relaxation system. Why it works: activates the parasympathetic system, lowering heart rate and delivering deeper tranquility. Reference by Breathe In, Chill Out, Cleveland Clinic. Tip: place your tongue behind your upper teeth. Breathe through your nose on the inhale and out through pursed lips on the exhale. Studies show just 1 session can reduce heart rate and stress hormones, plus improved sleep latency after a couple weeks of practice. Reference by gameofbreath.com, daniel-tims.com. Technique number 2, counting backward by threes. Distract your mind. Count backwards from 300 by threes. 297, 294, 291, and so on. This gentle mental exercise keeps your mind occupied without stimulation. It taps into core cognitive behavioral therapy for insomnia principles by interrupting racing thoughts, which often fuel anxiety and further wakefulness. Technique number 3, progressive muscle relaxation. Tense a muscle group for 5 seconds, then release for 15. Work head to toe or toe to head. This promotes body awareness, lowers tension, and signals to your brain, everything's okay, time to sleep. Research shows this technique can reduce sleep latency by up to 25 minutes in older adults and help manage pain that disrupts sleep. Technique number 4, non-sleep deep rest, or NSDR, or Yoga Nidra. NSDR means rest without fully sleeping, like mindfulness, body scanning, guided imagery. Promotes dopamine restoration, cortisol drop, mental rest, even if you're awake. Reference by Sleep.com, Psychology Today, Verywell Mind. A week-long NSDR trial decreased stress, improved midday energy, and eased nighttime awakenings. Reference by Verywell Mind. What not to do: avoid these mistakes. 1. Looking at the clock. Studies show clock watching increases anxiety, raising heart rate, and preventing sleep. 2. Checking your phone. Blue light suppresses melatonin and stimulates the brain. 3. Unnecessary bathroom trips. Every movement raises heart rate. Keep essentials nearby, like a nightlight or water. 4. Turning on bright lights. Even dim light resets your circadian rhythm. Use low red light night lamps if needed. Warning: sleep apnea. If you wake up groggy with a headache, dry mouth, daytime fatigue, or morning confusion, you might have undiagnosed sleep apnea. Talk to your doctor. Simple in-home sleep tests are available. Treating apnea can dramatically transform sleep quality. Recap plus motivation. Let's recap. 1. 4-7-8 breathing. 2. Counting backward. 3. Muscle relaxation. 4. Non-sleep deep rest. Plus avoid those 4 sabotage habits. And consider apnea screening if needed. Empowerment. These aren't quick fixes. They're lifelong habits backed by science. Fact: better sleep helps reduce heart disease, memory loss, and mood disorders, as well as improve balance and immune function. Call to action. Try one tonight. Leave a comment below. What helped you the most? You deserve peaceful nights and energized days. These techniques give back nights that might have slipped away and open the door to renewed confidence, better health, and a richer quality of life. Sleep well, live well, and remember, you're not alone on this journey. If you found this video helpful, don't forget to like, subscribe, and join our community at Healthcare Bites for You for more simple, powerful health tips. Thanks for watching, and take care of your health.